It's time for an apple fritter. Here's your host, Jimmy Apple.
Welcome to another episode of An Apple a Day's The Fritter. I'm your host, Jimmy Apple. How you feeling today, my friend? You feeling good? You feeling strong? You feeling better than you did yesterday? Excellent. You can't ask for better than that. We have another good one for you today. Is marijuana bad for you? You're going to want to listen to this episode. Believe me when I tell you that. And I mean really listen to this episode. So sit back, relax, and listen to what Dave has to tell you today.
Is weed bad for you? The negative health effects of marijuana. Marijuana is one of the most commonly used drugs in the United States. Although legalization activists and many marijuana users believe smoking pot has no negative effects, scientific research indicates that marijuana use can cause many different health problems. After smoking marijuana, you can start feeling its effects almost immediately. These effects can last up to 3 hours. In contrast, when eating marijuana-based foods, such as gummies and brownies, the effects are delayed, but usually last longer. Marijuana's main psychoactive ingredient, delta-9-tetrahydrocannabinol, THC, attaches to the brain's cannabinoid receptors. These receptors connect to nerves in the brain that influence pleasure, memory, thought, concentration, sensory and time perception, and coordinated movement. Multiple studies have linked marijuana use with a higher risk of the following psychotic symptoms: delusions, disorganized thinking and speech, hallucinations. Teen marijuana use is also linked to an increased risk of depression and suicidal behavior. Inhaling marijuana smoke causes your heart rate to speed up, forcing your heart to work harder. These effects, which start within 15 minutes and can last for up to 3 hours, increase your chance of a heart attack. In fact, research shows your risk of heart attack can increase up to 5-fold within the first hour after smoking marijuana. The chemicals in marijuana are also linked to an increased risk of heart failure and a heart rhythm disorder called atrial fibrillation. Frequent marijuana use among young people is even linked to an increased risk of stroke compared with those who don't use the drug. According to a 2017 study, heavy marijuana use on a regular basis may reduce bone density. Specifically, researchers found those who used marijuana heavily, more than 5,000 times during their lifetime, had a 5% lower bone density than those who did not use marijuana at all. This drop in bone density raises the risk of bone-related health problems, such as osteoporosis, which can increase the risk of bone fractures. On the flip side, other studies suggest that THC, CBD, and other cannabinoids accelerate bone healing and can make bones stronger after a fracture. While marijuana may be less dangerous than tobacco to lung health, the harmful effects of smoking marijuana shouldn't be ignored. Marijuana smoke contains many of the same harmful chemicals as tobacco smoke. And like tobacco, smoking marijuana, even infrequently, can cause some of the following symptoms: acute bronchitis, chronic coughing, increased sputum, phlegm, shortness of breath, wheezing. According to a review published in 2019, regular marijuana smoking is also associated with respiratory problems such as chronic obstructive pulmonary disease, COPD, and recurrent lung infections. According to a review published in 2015, one study found that marijuana smokers were 3 times more likely to develop cancer of the head or neck than non-smokers, but that study could not be confirmed by further analysis. Because marijuana smoke contains a number of carcinogens and 3 times the amount of tar found in tobacco smoke, it would seem logical to deduce that there is an increased risk of lung cancer for marijuana smokers. However, researchers have not been able to definitively prove such a link. Even though researchers have yet to prove a link between smoking pot and lung cancer, further research is needed, and regular smokers may want to consider the risk in the meantime. In addition to affecting fertility, marijuana use during pregnancy can be harmful to a baby's health and cause some serious problems. Specifically, babies born to those who use marijuana are more likely to be underweight at birth and be born prematurely. Marijuana use during pregnancy can also increase the risk of stillbirth. Studies also show that children born to mothers who use marijuana during pregnancy exhibit some problems with neurological development. These can include hyperactivity, impulsivity, problems with executive function, problems with sustained attention and memory. There are also risks to the pregnant mother. Marijuana use can increase the risk of anemia, confusion, and forgetfulness during pregnancy. I hope this information is helpful. Now, I'm gonna pass this back over to Jimmy.
Thanks, David. And I want to thank you for being here today, my friends. And I want to remind you, over at www.famousapple.com/group, that's our Living with a Disability page on Facebook, the conversation is going on the topics that we're talking about on the Apple Fritters here. So if you get a second, go over there, check it out. You're more than welcome to join in and put your opinions down. Also, if you decide you'd like to come on the podcast and discuss the topics we're talking about, you can write me at jimmy@famousapple.com and we'll set up for you to be a guest on the podcast. You're more than welcome to do that as well. You may not agree with what we're saying here, and you can state your opinion. If you have facts to back it up, even better. I want to remind you, my friends, no one ever went blind by looking at things from the bright side. So give it a shot. Take a look at things from the bright side for a change. Also, remember this. Things can always be worse. Right now, there's somebody somewhere wishing that they were in your position. So things can always be worse. Remember that. And I need you to do me a favor today. Be the reason somebody smiles. You'll see how good it makes you feel. Give someone a hearty handshake, a pat on the back, a smile, wave. Be the reason somebody smiles. I want to remind you, an apple fritter comes out every day at 4 a.m. That's right, we're like the elves. We're up early, we're making you fresh apple fritters every day, 5 days a week. So make sure you check them out. You've been listening to An Apple a Day's The Fritter. My name is Jimmy Apple, and I'm going to talk to you again tomorrow. Have a great day today, my friends.
Join Jimmy tomorrow for another apple fritter. In the meantime, stop over at our YouTube group page, Living with a Disability. Join in the conversation and make some new friends. See you next time.